Hi dear friends, welcome back to Alpha Physio Pelvic Care, all things pelvic health. If you don't know me or you see me for the first time, my name is Anastasia Ovarova. I'm a practicing pelvic floor physiotherapist with over 10 years of experience. And in my channel, I share absolutely everything pelvic health for different conditions, different populations. I share my clinical experiences, my tips, my advice, everything pelvic health. As you have noticed already, today's video will be for my moms-to-be, for pregnant. I like to wear this pretend belly because it kind of separates the videos for pregnancy from all the other videos, and also gives me a little bit of a feeling how the movement would be also for pregnancy. Although I have kids and I went through 2 pregnancies, it's been a while and sometimes I'm forgetting the feeling. So today, before we start, I would like to tell you something that most of the moms-to-be will experience. I would say majority than a minority, but they're not told anything about it and they actually are left quite often to deal with it by themselves and on their own. And today I will talk about specifically leaks, urinary leaks, could be also fecal leaks, so basically incontinence that already started in pregnancy. Often women will be told, well, you're pregnant, what did you expect? Your body is growing, your ligaments are stretching, your pelvic floor is getting weaker, and all of that will be true. Ligaments are stretching because of relaxing, because of huge amounts of estrogen that we are not going to get any other time in our lives, because of pelvic floor increasing in length 200 to 300%. So it's 2 to 3 times the pelvic floor muscles, the muscles that sits at the bottom of our pelvis and actually keeps us continent and makes us go to the toilet in a controlled manner. They are stretching, plus they have to carry the baby. Therefore, I will talk about and actually show you some exercises that you can already start in pregnancy and that are safe in pregnancy in order to help your pelvic floor to have better function, to keep it strong but also flexible, because we don't want strong and tight pelvic floor. And the most important, remember that post-pregnancy recovery, that I have plenty of videos on in my channel, starts in pregnancy. Ideally, we should start to connect our pelvic floor, to work on our pelvic floor and deep abdominal muscles in pregnancy. And this will take you 3 steps forward when you give birth, because the principle of the work, of core, of breathing are exactly the same. There is nothing new about it. Let's today do some exercises that will help you to keep your bladder in check, reduce some urgency that you might feel, and they will help you to make actually on time to the toilet. Before you continue with this video, I would really appreciate if you drop that like there. Press the subscribe button. I share really my best advice here in the exercise I also give to my clients in this channel, so you can always find something for yourself or share with your loved ones. And let's begin. See, I'm sitting on a chair and we will actually use the chair today to some extent, and let's start on a chair. As pregnancy progresses, it gets a little bit more difficult to get down on the floor and to find, the place to lay down. Although we will make exercises on the floor, let's start with the chair. And preferably your chair should be nice and hard. Why is that? Because it will give you feedback, the sense of moving your muscles against the hard surface. If you're on a soft, kind of sinky chair, you might not have enough sensation. You might not feel that sensation of muscle actually contracting. And we will also use a simple pillow. Pillow we will use for our inner thigh muscles that will help us with pelvic floor engagement, plus also help us with any potential pubic symphysis pain, so the pain around pubic bone that might occur in pregnancy. So we place our pillow in between our knees and we sit on a chair nice and straight, feeling our sitting bones on the chair, and we focus on the area right between the sitting bones. This area is called perineum and it's situated between your vaginal opening and your anal opening. If you feel better sensation and engagement around your vaginal opening or anal opening, that is also fine. In my experience, people get different feedback better than another. So sometimes I say like squeeze and lift your anus, they're not sure what you're doing. But when I say think about holding a tampon with your vagina, and it clicks immediately, and vice versa. So whatever is better for you, you can try think about all the areas, but just be careful not to squeeze your bottom muscles. We are not doing that today, so we are not lifting. And how to know if you are squeezing your bottom muscles or not? If you do this exercise in front of the mirror and you squeeze your bottom muscles and you see that you're getting a little bit taller, you are probably not doing it right and squeezing your glutes. If you just engage your pelvic floor and your tummy, your position on the chair will not change. Let's place the pillow between our knees. We take a nice deep breath into the side of our ribs, into our diaphragm, into our lungs with the help of our diaphragm. The poor thing is overstretched now by pregnancy, but we will still train it. And as you breathe out, you think about lifting, I will say, anus. I will focus on that area, lifting it away from the chair, in. And by that time, when you do the strong lift, you will also have the sensation around your vagina. It's normal. Plus 50% effort on squeeze. We don't want to squeeze the soul out of the pillow. 50%. Let's try again. Breathing in, breathing out, lift, squeeze, and hugging the baby with the tummy without changing position of our body. So breathing in, breathe out, squeeze, breathe in, and breathe out. Your main sensation of lifting should be somewhere around this area, okay? Somebody will feel it more here, somebody here, somebody here, somebody all together. So somewhere there. And we repeat this 20 to 30 repetitions. You can always make a break, make sure you don't fatigue, and we move on to the next exercise. For the purpose of the video, I will use the chair. However, if you want to use the chair, the edge of the chair should be smooth and the chair should stand against the wall. In ideal situation, you want to use the edge of the sofa that is nice and steady against the wall, not gonna slide anywhere. Or you can do this exercise also with a big ball by laying down and supporting yourself on a big ball. Just for the purpose of the video, so everything fits in frame, I will use the chair. But you have to have a very steady, sturdy surface. So I'm laying down in the area where my bra line is approximately. And again, I'm placing the pillow here in between my knees. And what I'm going to do is I'm going to do basically the bridge, breathing in and dropping my pelvis down. So if you're supported partially on the sofa edge or on the ball, the pelvis hangs free. We breathe in, and as we breathe out, squeeze the pelvic floor, gently squeeze the pillow. Here your gluteals will come to equation as well, and this is absolutely fine. We do want this with the bridge exercise. Breathing in, drop, breathe out, pelvic floor first, focus there. Hugging the baby with the belly, breathing in, and breathing out. Always try to aim for 3-4 second breath in and breathe out. So as you breathe out, you have this time to engage your pelvic floor fully and hold it there for a second or two, breathing in and breathing out. And again, I would repeat it for 20-30 repetitions. You can do it with a break. People might ask me why you cannot just lay down and do the bridge. I am not a fan of placing pregnants on their back, especially for a prolonged period of time, especially after third trimester. But even in the second trimester, I have a whole video on it, why I don't put pregnants on the back. You can check it in the pregnancy playlist. Some pregnants will feel absolutely fine being on their back and doing the bridges. Some will get, the moment they get flat, they get very dizzy, they get very nauseous. So I just stay away from on the back exercises for pregnancy. And if somebody wants to choose this position, that is fine to do at home. You can also do it on a flat back if you feel all right with that. Moving on to our last and third exercise that you can do. This is exercise modified 4-point kneeling engagement. Why modified? Number one, we will use the chair to lean on it with the elbows. Why is that? Quite often, pregnants are suffering from carpal tunnel syndrome and they will struggle to put their hands on the floor and they will have pins and needles immediately. I see it quite often in my class. And number two, I do also notice that many pregnants will get either heartburn or nauseous when they're in a 4-point kneeling, and therefore they want to be slightly elevated. Of course, you can do this exercise on hands and knees, and you will see that it's very easy to modify on hands and knees. I'm just giving you all possible modifications for your comfort if you do suffer from heartburn, from nausea, and also from carpal tunnel syndrome. So we will use our lovely chair again, and we'll lean on the chair with our elbows. And I'm going onto 90 degrees flexion on my hips, and my arms therefore are slightly more open. I'm taking nice deep breath into my sides here, and as I breathe out, I squeeze my pelvic floor, hug the baby with the tummy, trying to hold also the P, the imaginary hold. Long breath out, breathe in, I lean back, I open up my sitting bones, I relax my pelvic floor. Breathe out, long breath out, squeeze, lifting pelvic floor, squeezing it, hugging baby with the tummy. Breathe in and breathe out. Okay, and again, you can repeat this exercise 20, even 30 repetitions if you need, with a break. And you can do all of this kind of complex of exercises daily. It will take you probably maximum 10 minutes, but it will really give you that sense of control of your pelvic floor. It will absolutely prepare you for post-pregnancy rehabilitation. It will help your muscles to switch on. So you will not have to, again, from the beginning, to learn to breathe, to engage. And also, when you breathe in, squeeze, and when you breathe in and relax and breathe out and engage, when there is this all the time pelvic floor muscle mobility, it can also help you in labor to have effective pelvic floor that is able to relax when necessary to push. So this is also very important. I hope these exercises helped, guys. Let me know what you think about them. Let me know if you try them. Let me know how was your experience in pregnancy. Were you told about leaks? Did you experience them? You were fine and there were no problems? So let me know about your experience in a comment. I hope you already hit that subscribe and like button, and we will see you back very, very soon. Bye.